Hello, my name is Ana Castillo, and today I'm going to be presenting my research on COVID-19 healthcare professionals' mental health. In March 2020, the World Health Organization claimed a global pandemic named COVID-19. The COVID-19 was first detected in China and quickly spread around the world. As of now, there is no cure for the virus, but preventive care has been enforced by the Center of Disease Control. Vaccines have been created and are used as a preventive measure. The pandemic has affected many people, but healthcare employees have taken a higher toll compared to other professions. During the peak of the pandemic, many hospitals and clinics were packed and caused many healthcare professionals to be overwhelmed by it all. Since healthcare professionals are essential workers and are in the front line of the pandemic, many got infected and passed away. Some of the stress and anxiety faced by healthcare workers was due to the following factors: the lack of personal equipment, fear of getting the disease, and massive increase in workload. It is essential to investigate the mental status of our healthcare employees and monitor their stress and anxiety. For this research, there are two target questions. The first one is, has healthcare professionals' anxiety and stress levels increased due to the pandemic? And the second question is, how were healthcare professionals' mental health before the pandemic started? For my methods of this project, a survey was created using SurveyMonkey to collect data about the healthcare professionals' mental health, depression symptoms, workload, stressors, and coping mechanisms among medical staff. The confidentiality of all participants was protected by not disclosing their names or anything that could identify a participant. Each participant completed a 10-minute survey. The survey consisted of 30 questions on their mental status on COVID-19. The results of a total of 29 participants that met the criteria of being a healthcare professional completed the survey. From the data collected, healthcare professionals are somewhat worried about this pandemic. Some of the emotions they have felt are anger, powerless, frightened, stressed, feeling trapped with the situation of their job. Healthcare professionals have gone through a lot ever since this pandemic started. Their stress and anxiety level has increased a lot during these tough times. In Figure 1, the results show that 35% participants felt as if they are working more hours than usual, while 34% felt that they were not working many hours. In Figure 2, 48% of the participants were worried that they would not have sufficient PPE, personal protective equipment. In Figure 3, the majority of them picked no as their response as to not suffering from any physical complaint or frequent illness. In conclusion, COVID-19 has affected healthcare professionals with stress and anxiety because they have heavily taken a load of responsibility. Some of the limitations of this project are small sample size. Results would have been better if more participants took part. SurveyMonkey questionnaire. There was some errors with the reports from SurveyMonkey due to the error in creating with survey instead of receiving the rating from each participant. An average was calculated and therefore those results could not be used in the data interpretation. Short amount of time in collecting data. Discussion. Overall, this research showed some of the stress, anxiety, and burnout levels on healthcare professionals during COVID-19. Healthcare employees should find ways to help their employees during stressful times, such as the following: rotating schedule if allowed to give employees sufficient time to rest for the next day, activities to reduce stress, free gym members, and etc. Provide counseling if needed. Thank you.